The next one is blue blockers. So I believe this is our last D tier item. Blue blockers, potentially helpful maybe the last hour of the day, but most people wear them the rest of the day, and that can actually be detrimental to health.
Can decrease your color sensitivity for blues and greens, I believe. When these first came out and people were wearing them all day and all night, a lot of people really screwed up their vision.
The next tier is D tier, and perhaps we can run through these a bit faster unless they need nuance described. The first one that we can talk about is urine and salivary hormone testing. So especially if you get at-home urine and salivary hormone testing as the only testing without blood testing in order to see if you need hormone replacement or hormone balancing or not. There's, of course, some exceptions to this. There's really good candidates that benefit a ton, especially people looking at cortisol and whatnot. But there are certainly places that you can go for healthcare advice that this is the only test you get, and they tell you items secondary to it, which are often just wrong. For example, if you have a high SHBG, then androgens and estrogens are going to look lower. If you have a high CBG, then urinary and salivary glucocorticoids like cortisol, cortisone, and progestogens are going to look lower. It's a solid D tier test.
Yeah, especially if you're looking at like urinary neurotransmitters, hydration, and how people eliminate different hormones and drugs. There's a lot of genetic variability there, which I don't think is accounted for. Nope. And I do like the cortisol salivary test. It's probably my favorite peripheral hormone test. Yep. I guess if that's the umbrella we put it under. And then if you're looking at another example in the dried urine testing, you can get the ratio of the different metabolites of estrogen being metabolized can be useful because there are some associations there with a more favorable metabolism pathway, less favorable that's been associated, not proven as causal, but associated with better or worse outcomes as it relates to breast cancer. So for women, postmenopausal women especially, that can make sense to check. But unfortunately, it does come with a conglomerate of other tests that aren't particularly useful.
I think that's a good summary. We mentioned genetics. A lot of basic genetic tests, especially the retail direct-to-consumer, check these 12 single nucleotide polymorphisms, and it's going to tell you everything to do, how to change your diet, how to change your lifestyle. It's going to unlock the code to your genome by just testing. A SNP, by the way, is a single nucleotide polymorphism. It's like testing one letter of one word, of one sentence, of one paragraph, of one chapter, of one book, of the entire encyclopedia, except even on a much larger scale for your genome. And yes, some SNPs are definitely helpful, but not for every single individual. For example, if you're someone starting an HRT, and you're at risk of venous thromboembolism, it might make a lot of sense to check your prothrombin gene, your factor 5, your factor 2, your factor 8 in some cases, your protein C, your protein S. But for most people, especially just literally just a SNP, it is not a good return on investment. You're often paying hundreds of dollars for information that tells you nothing that is clinically significant.
And that is the important point, is that the test results are only as valuable as the interpretation. And I've said this before, but I'm going to say it again because it's extremely frustrating when a genetic testing company puts someone in the 99th percentile for developing a blood clot when they don't have a factor 5 or a prothrombin mutation, the two strongest known genetic associations. So keep that in mind. Take those with a grain of salt. Make sure you're talking to a provider that is knowledgeable in this area, or even a genetic counselor if you are getting genetic testing done. Yep. And that could apply even to the blood testing, making sure that it's interpreted appropriately, because that's where the real value is going to be.
Yeah, I would throw in age clocks, regardless of the age or epigenetic clock, biologic age clocks. I would put all of them in this category as well. They basically just tell you how healthy you've been the last day or two, because those numbers can change so quickly. We'll have much more on that later, but it's also D tier, maybe even R tier.
Yeah, I saw recently someone tested 3 different epigenetic age clocks. They were not taking rapamycin, got all 3 tests done, started taking rapamycin, did all 3 tests again, and almost too perfectly, one test showed that they got younger or healthier. One test showed they stayed the same age, and the other test showed that their aging was accelerated. So take from that what you will. I thought it was pretty comical. And there's also some research that's been done in cancer treatment, chemotherapy, where it accelerates age clocks and then the age clocks slow down. But if you are undergoing active cancer treatment, you don't want to stop your chemo just because your age clock is going to go down. So they don't have a lot of clinical validity at this point in time.
The next one would be one single day where you get an executive physical day. So
what was the pitch for this? We saw a website when we were reviewing basically what's offered and kind of what the leading clinics are doing. It was like, devote an entire day to your health, which is about 0.3% of the year. So that's the amount of time you devote to health. And then you don't worry about it the rest of the year, right?
Yeah. It's like, let's say you have a car, because at the end of the day, again, we're just organic machines. You go to an expert mechanic who is also a pit crew chief for Formula One. This is a true expert in cars, both the structure and function and optimizing performance, not just preventing it from breaking down. And you hook it up to their computers and their machines, and it gives you a text report read off. And you get a summary of perhaps a couple of recommendations just that day. And then you're supposed to take the next several decades of having the car and I guess interpreting that yourself. Obviously, the benefit would be if you paid to have that pit crew chief or that mechanic give you advice on your car longitudinally. You can send them messages whenever, and you are, they are your employee and they take care of your car rather
health
than
consultant.
Rather than just one day. It's a moving target and things obviously change, problems arise, and you don't want to have to go back one day, 4 or 5 different times a year. And some years there might be dozens of problems arise. And perhaps if you had been having that mechanic longitudinally the year before, they could have prevented those from happening.
Yeah. The mental picture I'm getting, talking about Formula One and performance, is you have a car, you want to get more horsepower out of it, and you're just slapping a tune on and putting it on the dyno once a year.
Yep.
It's like, okay, we've got the tune. Do you want us to run it again? Nope. Only do that once a year. So you're not going to get a lot of value out of that.
Yeah. And a lot of these physical programs where, you have to do every single piece of imaging. I've seen a lot of them. We don't need to name them, but there's a ton of these startups. They could cost $5,000, $10,000, $20,000. And yes, everybody gets their SNP testing, D tier. Everybody gets their gut microbiome, C tier. Everybody gets their salivary urinary hormone testing, D tier. Everybody gets their CCTA. Okay, that might be reasonable unless you're well under the age of 30 with no other risk factors.
And that is a tiny fraction of the $20,000 price tag on some of these.
So you add up all these and they add up to, and by the way, all those things that these executive physical programs, and yes, we are launching our own program, which is not just one day, but longitudinally. More information on that later. All of them add up to maybe 4,000 total. A fraction of the cost.
Yeah,
so you're like
that.
Where'd the other amounts of money
Follow
go?
the money.
And they don't even have to message you back and forth for an entire year, thinking about your case, combing over history, taking all the things into account. It is just, the executive physical days, really, we should probably put them in F tier. The big caveat is a lot of them do calcium scores or clearly CCTAs, Pernuvos, things like that, which do help catch things early on. So if you have a lot of disposable income and you aren't really worried about people ripping you off and you get some degree of health information, then I suppose it's reasonable. There's just better programs to spend it in.
Yeah, I think I saw recently, it was the American College of Radiology, something like that. They put out a statement saying that they do not endorse, or there's no evidence to support, full body MRI scanning. Talked about health anxiety and incidental findings. And if people are counseled appropriately on that, then you're really deciding who's a good candidate and who's not. If you have someone that thinks that they are developing cancer or thinks that they're having a heart attack every time something abnormal happens in their body, one ache or pain, probably not a great candidate to go and get a full body MRI, a lot of invasive testing. If you have someone who is in tune with their body and wants to be 10 out of 10 preventive, some people do want to be very proactive and aggressive with health prevention, and that's not a problem. It's not a character flaw to care about your health. Then it could be very reasonable.
Yeah, it's frustrating when individuals have gotten several of these, what we call direct-to-consumer tests, whether they're genetic tests, whether they're full-body MRIs. None of these have been ordered by a physician. They probably have a bunch of labs as well. Maybe even labs that check for cancer genes, not ordered or indirectly ordered by a physician. I don't know what the phrasing on that is, but they think they're very high risk of cancer and they think they have all these issues. And they're really kind of at a point in their health journey where they are so far behind because they already have the sick role. And again, I know we talk about this all the time, but they already see themselves as sick and something is wrong and they'll never be healthy. And perhaps they're even on disability. And instead, before they start getting all these different tests and trying to be their own doctor, they should have just sought out high quality medical advice. And then they would have still found all the same things, but within a different context. So,
and this is where we could circle back to tier A, talk about therapy when it's indicated. If someone has a sick identity, you can find ways to still associate yourself with health and identify as being healthy, even if you have a medical condition. But there's plenty of people out there that have high blood pressure, but it's managed and they are still a healthy person. So just because you take a prescription medication doesn't mean you are unhealthy. Mm-hmm. There's sort of this obsession with being medication free in certain influencer spaces and the social media health circles, but not really warranted because someone can use a medication to improve their health.
Yep.
Just like you can use a supplement or a vitamin to improve your health.
Yeah. I always like to say, my wife lovingly calls me the world's biggest hypochondriac. And I still see myself as healthy. And yes, sometimes whenever I get my labs back, more so years ago compared to now, I would feel terrible when I got them back. And same thing for imaging studies too. And I often do take about 10 different pills a day, half of them medications, half of them supplements. So for a lot of people, that would be difficult to do that and get the amount of blood tests and whatever other indicated tests that I do for my health history. But I still am able to see myself as someone who is healthy.
Yeah. And you probably didn't start all 10 of those things at the same exact time. It's been a health journey, as has it been in my case.
Yep. The next one is blue blockers. So I believe this is our last D tier item. Blue blockers, potentially helpful maybe the last hour of the day, but most people wear them the rest of the day, and that can actually be detrimental to health.
Can decrease your color sensitivity for blues and greens, I believe. When these first came out and people were wearing them all day and all night, a lot of people really screwed up their vision. Now, it does appear to be transient, which is good, but if you're going to use blue blockers, probably only makes sense to use them for a couple of hours before bed. Red light therapy also has some weak data out there supporting use a couple hours before bed might be helpful for sleep. But again, not where we're telling people, put your health dollars here.
Yeah.